So Thursday is usually the time we set aside some time to talk to members of the medical community. Today, no exception. We have with us today Dr. Michael Jaskolka from the Hanover Regional Medical Center talking about maxillofacial surgery. It was one of those things that when I looked at it, I kind of had an idea, but then again, as a, well, maybe I don't. So let's start with maxillofacial surgery and actually what that entitles.
So it really covers a wide range, mostly an anatomical area. My primary interest is in treating children with cleft lip and palate and other facial issues. Patients that have jaw abnormalities, patients have had facial injuries and require whether that's primary care for those kind of injuries or reconstruction, and then pathology. Skin cancers and things like that.
And I know, you see a lot of things in headlines with doctors traveling overseas, taking care of patients in remote parts of the world. Now, you're saying this is a new program here that is actually taking place here in Wilmington now.
Yeah, so it actually was my partner, Dr. Goldwasser, Michael Goldwasser, who recruited me to join him, kind of started to develop the cleft lip and palate team or group over the last year to 2 years. And it's a really nice synergy between some of the community providers, the hospital, the Children's Hospital, and super supportive, and the Coastal Carolina Neonatology and Children's Services Group. And everybody's really kind of come together to try and just provide a new multidisciplinary team service to kids with cleft lip and palate and other craniofacial conditions. It's a really quite a new and exciting service to be able to offer to Eastern North Carolina.
When you see patients come in that need the procedure to have the corrective surgery done, what kind of road are they looking at? Is it an overly invasive surgery? And the success rate, I would think, seems to be fairly high.
Yeah, I think I give talks on this kind of thing on a regular basis to a variety of different groups, whether that's social Rotary Club or I travel overseas with folks and or other educational opportunities. But the title of the talk is always Birth to College, so it's a really staged approach over time, and surgery plays a part in it. They're actually not tremendously major surgeries like a heart transplant or something like that, but probably the most important part is a staged surgical approach, because kids grow over time, so you have to have kind of the eye on the long-term prize, and then really it's the team approach with having a bunch of different other services and providers that are involved.
Because it is a long-term, do you want these people, the parents, to have their children come in and do this as they're as young as possible?
So I actually like to see the families, a lot of times this is actually diagnosed prenatally by ultrasound, and I like to see the families at that point to provide education and support. And then, historically there were people that would try and do a cleft lip repair immediately, and that's actually been borne out to be harmful. So we wait, and it gives us an opportunity to do a little bit of what's called molding, and really the surgical repair of a cleft lip doesn't happen until somewhere between 3 to 6 months, depending upon how much of the sort of molding and taping we're trying to do with the nose and the lip.
And again, it's just another reason why we are so blessed to have a facility like New Hanover Regional Medical Center here. You often hear people talk about, I got to go to Duke, I go to Chapel Hill. This is something going on right here in our own backyard. I appreciate the time, Doctor. Thank you very much.
Thank you.